Well, joining me to discuss this is Dr. Bob Gill. He's an NHS GP. He's also producer of the documentary The Great NHS Heist. Good afternoon to you.
Afternoon, Julia.
Thank you so much for joining us. Obviously, this is a really big concern for a lot of people. We're looking at now all the 8 million people effectively on NHS waiting lists. Some people will be waiting for, really serious healthcare needs, hip operations and things like that. People waiting in pain. Other people just waiting for a consultant's appointment, which they could wait many, many months for, unless you're as sharp-elbowed as some people. And meanwhile, pretty much everyone I know who can afford it is saying, I'm going to jump the queue and I'm going to go private. But that is just simply not even an option for most people on their budgets. And it does create a completely two-tier service, doesn't it?
Yeah, absolutely. We have had a decades-long run-up to the current crisis. Even before the pandemic, the waiting lists were above 5 million. Now they're approaching 8 million. We've had a decade of defunding on the back of the financial crash. A lot of NHS budget is seeping out the back door, servicing private finance initiative debt, servicing the marketisation, and servicing outsourcing giant profits. So a lot of the money isn't reaching the patient. We have a problem with recruitment and retention of staff. Doctors and nurses have experienced a 30% real terms pay cut over the last decade. So it's a perfect storm, but this is no natural disaster. This is a consequence of deliberate public policy to create this exact two-tier system that you lay out, because the model for healthcare in this country is to replicate that of the American system.
Oh, can I stop you there, Bob? This is such a ridiculous conspiracy theory. The idea that a government which knows that one of the reasons why it may be turfed out of office next year is because of the long waiting list on the NHS, the idea that they deliberately, let's completely damage and ruin the NHS because and turn it into an American system, which is literally the worst system for healthcare in the world when it comes to the actual amount of money you spend and your health outcomes. Why on earth would they want to do that? I mean, that's just the most nonsense conspiracy theory.
Well, it's not a conspiracy theory. So I've been on this, studying this matter for at least a decade. Last year, July 2022, legislation was passed creating 42 new public-private partnerships called integrated care systems, which are based on the American managed care system. They will be run by private companies who will have the power to deny patients care, and what is left over will be taken as profit. That's not a conspiracy theory. That is legislation.
Yeah, I mean, and that's something many of us would be very unhappy with. But bearing in mind, of course, the doctors we have most contact with are GPs, and they are privately employed. They're self-employed. Okay. They're not actually. They're only contracted to the NHS. Can I just want to go into this?
Well, can I come back to you on the point you said about conspiracy theory? Okay. You are assuming that our governments want to spend taxpayer money in the most efficient way. That is completely false. What they are doing is siding with private corporations, international finance, to boost their profits. They're not acting in our interest.
Okay.
That is the largest
the largest privatisation of our healthcare service in my lifetime happened under Tony Blair, under a Labour government, as you will well know. Here's the thing. There are many different systems for running healthcare. The one system that definitely is bad is the American system. People don't get... if you're not well off, you haven't got healthcare insurance, you basically have for a first world country, you have a very high chance of not living as long as you should do. Whereas we've got plenty of other systems other than the NHS. By the way, not copied by any other country. An amazing system when it was set up, absolutely. However, if it was so amazing, you would think that most other countries would have followed it in the Western world, and they haven't. They've gone for these systems where France, Canada, Australia, Germany, Italy, all these other countries where they've got effectively a sort of a social insurance system where the poorest people are covered by the government, by taxpayers, but other people basically pay premiums and they get their healthcare. Those systems result in far better health outcomes for the same amount of money, where there is the same amount of money spent, than the NHS is delivering. Why are so many, for instance, doctors and nurses, we're told, leaving the NHS, this wonderful, brilliant system, and going to work in countries which have this other system, when they're claiming that the NHS is the best in the world?
Okay, so you have three systems. You have the American system, the most privatized. You have the NHS, which used to be a beverage system. It's been repurposed over the last 3 or 4 decades. What we have now as the NHS does not resemble the model that it started off as being. You said it wasn't replicated anywhere else. It was replicated in Scandinavia, in Spain, in Israel, in Saudi Arabia. So that is completely wrong.
No, but they've not kept it like that.
And you're deflecting onto this Bismarck model, the German model, the European model, which has double the transaction cost. You have to run a publicly funded service, and then you have to have a parallel bureaucracy to run the privatized.
And yet if I've got cancer in France or Germany, chances are I'll survive far more chance of surviving than if I live in the UK.
Yeah, and you've been
Seems
spending
like a good deal to me.
Well, you've been spending more per portion of GDP for the last 40 years. So no wonder they have a head start. They're starting with far more investment, far more infrastructure. You know, Germany has triple the number of bed capacity that the UK has. So if you don't have the staff, you don't have the beds, and you don't pay the staff well, surprise, surprise.
Okay, the thing is, yes, you're right. Look, we have fewer by a long way. We have fewer doctors, nurses, and every other specialist, and fewer beds per head of the population than most of our European counterparts that have better outcomes. But we don't spend a lot less money. We have a huge number of staff. The trouble is, an awful lot of them, and I understand you need people in management. I understand you need people to make the appointments who aren't carrying out the surgery. Of course, you need a number of those. But we're spending a lot of money on the wrong stuff.
Well, on this, I absolutely agree with you. I pointed out earlier on, the money isn't going where it needs to go.
Well, who decides that?
We have a bloated management bureaucracy, which has been necessary to see the repurposing achieved. You have the burden of private finance initiative debt, which is sucking out money to service interest rate payments and profits for private financiers. So you have a huge hemorrhaging of money, which isn't reaching the patient. And the system that I pointed out, as I say, is not some natural disaster.
You're saying you think it's deliberate policy. Okay.
Direct consequence of sequential legal changes.
All right.
You can look
Bob
see
Gill,
the effect of those legal
stay
changes.
on the line. I just want to bring in Sam Armstrong, who's been joining me in the studio. He's a Conservative commentator. You've been champing up the bit, wanting to have your say. Come on.
Right,
here we go. Everyone, step in, everybody.
I'm going to risk some disagreement here. Let me tell you who the real problems are with the NHS. They are people like Bob. Bob is a GP, right? So let's just get this started. He works for a private company that takes NHS money, a little fee per patient, and every year or several years they go into a negotiation and they try and get as much money out of the taxpayer, you and me, for as little time treating patients as possible. Many of those GPs also take private things on the side and then charge the NHS extortionate sums to come along in bank work and all the rest of it. He says that there are millions of people out there somehow privatising the NHS. Where are they? Who are they? Getting rich? Where are these
Well, they're your
Bentleys?
mates in the Tory party, he says.
My mates in the Tory party. Let me tell you, if there's one issue that the Tory party are terrified of, it is the NHS. They have put more money into the NHS than at any stage in electoral history.
But a lot of people would say belatedly, although the NHS funding did go up during the austerity years, in real terms, it went up by a much smaller amount than it was previously going up, and that didn't take into account the fact we were older and fatter and more needed to be spent. And we've got far more treatments that cost a lot of money.
Well, just on the fatter point, by the way, it is not the case that obesity costs the NHS loads of money. They tend to die of heart attacks, which are a lot cheaper to treat than, say, for example, dementia. But look, there's a serious problem about an ageing population, putting more demand on it. But there is also a problem with nurses, union leaders and the like running the taxpayer ragged. They are all now working fewer shifts than they ever did after more training, costing the taxpayer more. I may be the only man in Britain who thinks this, but I think the problem with the NHS is at times the way that nursing and doctoring leaders have tried.
I don't think you're on that small a minority anymore. Dr. Bob Gill, come back on this. Come on, there's plenty to get your teeth into there.
Yeah, so this is a typical strategy of government, is to scapegoat the very people who are responsible for taking care of patients. So scapegoating is the desperate sign that this guy doesn't have an argument. He doesn't challenge what I stated on the passage of the Health and Social Care Act last July. Maybe he doesn't understand what was in it. This was a legal change to create 42 new public-private partnerships. What is public-private partnership about? It's about directing taxpayer money into corporate profits. Look at who donates to the Tory party. There's plenty of private healthcare interests who are rubbing their hands together, delighted with the legal changes, and we have a diluted form of the Tory party in waiting in Sir Keir Starmer's Labour Party, who has no intention of fixing all the problems that I've relayed to you, which is what we need to do is renationalise, get the management structures out, and undo the toxic burden of private finance initiative.
Oh, do you know what? I'd agree with you on all that last bit completely. Look, I'm the daughter of an NHS GP. I've always relied on the NHS until last year when actually abject failing for a member of my family, although we've had some very good treatment for other members of the family when they've needed it. But the thing is, it's for a lot of people, it's a matter of luck whether you happen to have a hospital that hasn't got a long waiting list or you happen to have a good GP if you can get an appointment. And for a lot of people, they just feel they either don't go to the doctor, they're not getting treatment, they just wait months and months. We know you wait months for a cancer referral, you're more likely to die. It is really that simple. What do you make those? How many people? 1 in 8 people saying they're going private. Now, depending on what they're doing, whether it's an operation that costs £10,000 or a consultant appointment that costs 250 quid, some might be able to afford the latter. Most people haven't got a chance of affording the former. But what do you make of people doing that? Because some people apparently, according to this report from the Care Quality Commission, the Health Watchdog, they are actually going into debt to try and get help. I know families where the families have clubbed together, like, the adult children have clubbed together to put money in for their parent to get an operation. This while we're all paying, the highest tax burden in 70 years, but we're not getting the healthcare we want. At some point, there's got to be responsibility of some people working in the NHS for that, surely.
No, I think you're missing the point. The government has created a situation where people get desperate enough to opt to pay twice. You pay first through taxation, and then you pay second time either going into debt or using up savings. So the government doesn't mind fleecing the public multiple times to pay for the same goods or services. In fact, running down services. Another point that your guests let slip out there, he wants deregulation. He wants a dumbing down of service provision. They're talking about replacing GPs with physician's assistants or associates, a posher sounding name, with 2 years of training. That is inherently dangerous. This government and the government that will follow is taking us down an expensive, more dangerous route, which is going to cost individuals and the taxpayer more, deliver less care, and line the pockets of corporations. That is a fundamental point.
Bob Gill, we'll have to leave it there. I have to say, I completely agree with you on those people being trained for 2 years. I think this is just completely insane. I really do. Dr. Bob Gill, NHS GP, is also producer of the documentary The Great NHS Heist. Thank you so much for joining us. Just a quick final word to you on this before we go to a caller, actually, Sam Armstrong. Look, there are lots of very valid criticisms of the NHS. It seems to me a lot of people, whether they're left or right, have a lot of the same criticisms about bureaucracies and poor choices, money going on management structures, reorganisations, instead of on crazy idea, treating patients and keeping them alive.
Yeah, absolutely right. And Wes Streeting has said that he wants to make a series of changes that I would well agree with.
Is it easier for Labour to do that than the Tories?
Yes, and the problem is that you suggest even the most minor reform to the NHS, you have, and I apologise in advance for saying this, cranks and crazies like Bob that accuse you of trying to privatise.
I will not have my fellow guest called crank and crazy. I thought he meant me, to be fair, but there we are.